Hey, good Sunday morning to everybody. This is the Grizz. This is part 2 of the first aid pack overview. I have to keep these short because I got to keep them under 15 minutes, so let's get into it. This is a secondary aid bag that I have that's sort of a complement to the other one that I have. All right. Like I said before, on most of my trips, I only take Band-Aids and about it. And the other one is sort of a next level up, a little more, we call it trauma, so forth. And this bag is its complement to it. Now, you can create bags to certain situations. If you're just going for a day hike, you're going for a weekend, a week, you're going in the wilderness, you're going in the jungle, you're going in the snow. Each environment has a different environmental hazard, which most people should be aware of more so than trauma, hypothermia, hyperthermia, bug bites, bad water, severe weather, so forth. You're probably going to be dealing with those types of things: wind burns, sunburns, blistering, dehydration, those sorts of things contribute to more battle casualties throughout all the wars, and also mistakes and or accidents than actual combat deaths. Okay, so your environment is it's real, all right, and that should be taken care of. So you'll address, like you address your sleeping gear, your shelter, your shoes, everything to the environment you're in. So should you do with your first aid bag. Now, you might say to me, Bob, okay, you only take Band-Aids and so forth and so on, and I seem like a hypocrite. Well, I'm not. I have a prepper's mind like anybody else. It's just that it's needed when it's needed. and I'm not Chicken Little. The sky isn't falling right away. When the time comes, I pick it up and I go. All right. This bag addresses more splinting, more trauma, so forth. And your bag should be set up as to how you need things, okay? So the first thing you come upon someone is to assess their airway, okay, the ABCs, right? So you make sure they have a good airway. Now, in another bag that I have esophageal airways, and I have nasal cannulas for the nose for breathing, all right? That's for that big trauma next step up. Assess their breathing, look at bleeding, circulation, whatever. Okay. So when you come upon somebody, they say use gloves, so forth and so on. You don't always have time to put gloves on, but I do have gloves available right here, the top of my pack. These are little nitrile type things. They don't have to be sterile. Just have to be clean. Basically, a glove is there to protect you, okay, not to protect that person, but yourself. Also, if you want to really be a medic, there you go. All right. So it's an old armband we used to wear when I was in the Army. Okay. Secondly, is you might want to have the need to cut off their pants. Well, here's your bandage scissors to get at the bleeding. Okay. I'm not going to take them off. You know what bandage scissors look like. Secondly, if you do have that bleeding going on, the thing that you might want to have straight up, right, real close and personal to you, would be maybe a tourniquet. But what I have here is an Army constricting band, just like a belt. It's Velcro, and all it does is go about 2 to 4 inches above the wound with enough constriction to be able to get 2 fingers under. Okay. Now, what I'm telling you is things that I've learned. Some of these things may be outmoded. I try to read up on things to keep you current, but I want to keep it simple too. All right. So you got your breathing and you have your bleeding under control. So next you want to assess for other injuries, okay, and ask if the patient's conscious, not conscious, so forth. So if I come upon any type of fractures, and I have a wire splint, all right, and works like so. You can get a SAM splint because they're already padded, and I would suggest that you get something like that. You can go to any first aid or emergency or EMT store or whatever, and they will have them available. The other thing you want to do is have available right away is maybe pads, so that you can put on top of the wound. Okay, tear them open and throw them on the wound. Okay, it's dependent upon what you find and what you assess. All right. That being said, then you want to treat for shock. All right. Face is red, raise the head. Face is pale, raise the tail. Get them warm. Okay, covered up. Do not give them liquids or anything if they are unconscious. Okay, if they are conscious, allow them to sip and see how they tolerate it. Okay, but you want to keep them warm. You know, treat for shock. Okay. Now, diverging a little bit from that is, we always had, when I was in the service, you always had to record. Okay, so I have a pad here for recording that person's name, their blood type. If I'm going to take a TPR, temperature, pulse, and blood pressure, I would put it on here. Their age, or if they're on any medications, are they wearing glasses or contacts, so forth. This is pertinent information that when you evac this patient out, you want to give the EMTs, and so that they can give to the doctor at the treating facility. Okay, and that way they're not groping around looking for this and looking for that. He came in stable. You know, he had a heart rate of 70 beats per minute. His blood pressure was 132 over 78. He's a diabetic, so forth. Especially if they don't have bracelets and indicators that they have any other prior illnesses. Okay, so that's always good. We always had a pad and a paper, and we were able to mark on the patient or in the pad to give a history to the treating facility. Okay. All right. Now the other thing we can go down to is we're talking a little bit about little fractures and things of that nature. So say we have finger splints. Okay. These are malleable, which means they can be bent to the size of the extremity, or mostly just the fingers or toes or whatever. A lot of things can be done with buddy taping the toe or the finger and taping it next to itself. All right. Here is a larger finger splint and finger cots for the tips. Like you might want to put this, pat it and put it over top tip of the finger. It has a laceration. Another thing you might want to look at is nosebleeds. These are pledgets. All right, they're round cotton balls that you can make out of a 4x4 whatever, and they swell as the bleeding is absorbed. And you stick them down into, say, a loose tooth or a cheek injury, or even in the nose. You have a nosebleed you can't stop, and these will help compress. Okay. Let's see now. In the basic part of this pack, I have a suture set, U.S. Army suture set. You can buy them. Sportsman's Guide has them. Bud K has them. They have pickups. They have clamps and whatever in them. Okay, they open up in the sutures. They have different probes and so forth. Mine I've got through years of borrowing from places I worked to enhance my overall set. All right. I have ACE wraps in here. I have Elastoplast, which is good. I have different types of tapes, different type of ACE wraps in here, and things to bind wounds, to hold splints onto. 4 inches good, 6 inches good, whatever. Okay. Also in here, I have some suture. I'm not going to show you. I have some Massasaw. It's all for keeping the wounds closed and clean. I have Cling. Okay. Cling is really good for holding bandages to 4x4s to the extremity. Okay. These are mostly all the types of items we use for dressings. Okay, compresses, so forth, until they're evacuated. Also, I still have some more other pads, like I told you about Kotex and whatever. Well, I don't need Kotex right now because I have a lot of these. Okay, these are sterile, but you can use them non-sterilely just to be clean. All right, something that is sterile is ideally without bacteria. Okay, supposedly it is sterile. Once it hits the air, when you unpackage it, it is no longer sterile. It's clean. All right, and so instrumentation, packing, whatever, is not free of bacteria. It once it hits the air, there's may not be bacteria, but there may be different little particles that now are adhering to it. So it is clean. That's why it's important to lavage or to irrigate your wound, and then to put a good bacitracin or iodine or whatever on the wound, and then cover it with your clean dressing. Okay? All right, up in here, I have a irrigating syringe, okay, for flushing the eyes, nose, the mouth cavity. You can get a bulb syringe. They work quite well, same thing. This is a 30 cc syringe, and it's for irrigating only. All right. The other thing I have in here is a light, okay, to look inside people. This one is probably dead. I have to replace it. But you have a regular mag light or flashlight with you when you're out. Pair of wire scissors, cutting thick nails, anything tough, something that's like something lodged in the the body, eyes, whatever, like a stick or a branch or whatever. Okay, good to have. You can get them from some of your EMT stores. They usually have those types of things available. That's about it for this. Like I said, usually I would have airways. I have air splints and some other bigger items for larger trauma. You know, everybody talks about the shit hitting the fan, and you know, you're going to be carrying stuff for your family and whatever. Well, a medic has to carry double. You know, the machine gunner had to carry double. You know, everything. So you got to be in good shape too, and that's really important, fitness, and it's something I've been remiss at, but trying to get back on course. And when all else fails, and you need, you know, like to take something off, kukri, great for amputations. Okay, so anyway, I hope you enjoyed this video. I'll be posting some more down the road. It's tough to do field expedient type things. I'm not in the field right now, and I need a patient, and I've been trying to get my wife and my daughter to be patients for me. Okay, so we'll see how that happens down the road. So pretty soon I'll be starting with the head, the face and whatever, doing trauma there. Neck, we'll work our way down the body. Also, I will be showing you anatomy and physiology through charts, different bones, how to treat them and care for them, whatever. So if you like, subscribe. If you don't care. Put down comments, good or bad. I only answer them all. I always review the videos, and I hope you have a safe and prosperous day. This is the Grizz, out.